Instagram, hi Facebook, how are you? We are back for another episode of Let's Talk Tuesdays. It's so glad to see you. Thank you for joining us today. We have our update that we're going to be doing on the coronavirus and everything that has been going on and how far it has gotten. So just give me a moment here as I get everything set up. All right. Hi, and welcome back. Thank you for coming. I am Dr. Elisee. I'm a board-certified family medicine physician, the CEO and co-founder of Cornerstone Medical Group here in Coral Springs, Florida. And I've come to realize to be healthy, you have to address more than your physical health. That's why I help men and women reconnect their physical, spiritual, and cognitive health, their mental health, to bring satisfying wholeness to their lives daily. And I do that right here at our office in Coral Springs, Cornerstone Medical Group. So we are talking about today just the most recent updates of the coronavirus. I know everyone has heard about it. A lot of people are frantic about it. So we want to talk about a couple of different things. Our goal in our discussion today, as we chat very quickly, is a couple of things. One, we want to remind you again what this virus is and why it is such a scare. We also want to remind you, again, too, some of these words that you may be hearing right now in the community, something presumptive versus a confirmed case, what that means. And we want to hit it home to see what we're doing here in South Florida, and then what precautions, of course, that you could take as well, too. So if you know someone that's going to be interested in this, go ahead and let them know to go on and hop on live or on Facebook as well as Instagram so that we can have this discussion. So we're going to get right into it right now. So the coronavirus, we're familiar with this. The coronavirus actually started having some of its first episodes in the late 2019. So last year, December, November, that's where we started seeing it, right around the time of the Chinese New Year. That's where we started seeing all these different cases. To date, there has been 100, as of this morning, 100 cases in the United States of individuals infected with the coronavirus, 100. That brings us to a total of 10,000 cases outside of China. That's 10,000 cases outside of China. And the two newest cases actually occurred in Georgia. And those new cases that occurred in Georgia, they were linked to individuals in the same home. Those two individuals are in the same home. And those two individuals actually recently traveled outside of the United States, and they recently traveled to Italy. So I'm saying all this so that we could keep all these things in mind as we're discussing this, so that we can understand our risk and what it is that we have to do and what it is we shouldn't do. So we know the coronavirus, the biggest thing about the virus is that we don't have any medication for it. Viruses are different from bacteria, you recall, because bacteria, we could give antibiotics to control it. Some of the bigger complications that people are actually having with coronavirus that are linked to the illnesses and the deaths of the coronavirus is that it's causing a severe respiratory symptoms, okay? Because this is called SARS. It's the severe respiratory symptoms that individuals are having that's causing more of the problem, and that's ultimately causing the death of individuals. To date, in the United States, there has been 6 deaths that have occurred in the United States. Of those 6 deaths that have occurred, 4 of those individuals were either elderly or they actually had other severe underlying conditions that are going on. Again, we're saying all this so that you could keep in mind exactly what's going on and have an idea of just, number one, the precaution that you should take, and then not to just move on fear, because I think that what tends to happen, that we do have a public health emergency. There is a necessity to discuss this, but if you don't have all the facts in place, then you could kind of run off in fear and frantic and really not doing what is most important to do. So here in South Florida, there actually has been two counties that have had presumptive cases. So presumptive cases, that is the reality that the individuals, they were tested. It came back positive, but it was not yet confirmed. And because of this occurred in Hillsborough County and Manatee County. Because of this, Governor DeSantis went ahead and, of course, issued this health emergency that is taking place right now. That's in Hillsborough County and Manatee County. Those cases have not yet been confirmed. It's just presumptive. But still, with those confirmed cases, we still have to take all of the precaution. The statutes are currently in place that these individuals still must be under isolation so that they're not moving around. Something that we don't hear about as much is something that I want to share with you right now. This is the reality that the first time that we started seeing coronavirus was, again, in around December 2019 of last year. To date, there has been a total of, and I'm looking at this number so I could get it right for you, 90,926 people infected. 90,926 people infected. The good news is that 53% of those individuals have recovered. So it really does go back to the necessity, if you're having these symptoms, of course, or you're thinking that this could be the case, if you've traveled outside of the United States, then this is where you want to first contact the health department, so that you could let them know that you're coming, because we don't want to expose anyone that if you truly have been infected. And then go to the health department, contact the urgent care center before you actually go. In the state of Florida, this is what they are currently recommending. The advisory still exists that only if necessary, you should be traveling to 4 countries, only if necessary. So this ban or this advisory has been placed that only if necessary, you should be traveling to Italy, South Korea, Iran, or China. So Italy, South Korea, Iran, and China, these are the places that they are still saying do not travel to unless it's absolutely necessary. So now what do we do with all of these symptoms that we have, but more so, what can we do for the prevention? The prevention of this still is the same. I really can't underscore that enough. We have a lot of people that are canceling just regular activities that they have, whether it's in a public setting, and we can understand that you're taking those precautions, and of course that's important. But really, the most important thing that you can be doing, again, is your universal precautions. And what are your universal precautions? Your universal precautions are doing what we do for the flu. I keep bringing this up because it's so important. It's what we do for the flu. We are saying if anyone is sick, stay home. Stay home if you are sick. If you are sick, stay home. That includes for your children. If you need to take a day off from work, please stay home if you are sick. That's the most important thing. The second thing to do, and I think that we don't understand it because it seems so simple, the necessity to wash your hands with soap regularly throughout the day. Regularly washing your hand with soap. The question may present of, is the sanitizer just as good? No, the sanitizer is not just as good. We want you to wash with soap. Some people will say, go ahead and sing happy birthday to yourself to let you know how long you should be under the sink and washing your hands with soap to make sure that we are really getting rid of this and controlling it. And then, of course, too, when you are coughing, you want to cough into your elbow and not actually into your hands. I say this particularly the importance, and I wanted to bring this back up because, again, we had one of the most recent alerts that came about through South Florida, or through Florida in general, because of those presumptive cases in Hillsborough and Manatee County. Those truly still are presumptive cases, which means that they are in isolation, and it means that those individuals still need to go and get confirmed. But at the same time, too, you can do your due diligence in just making sure you're practicing your universal precautions. And what are those universal precautions? Ideally, you just say you treat everything as if it is infected. And the way that you treat everything as if it's infected, more so for yourself, is you control how much bacteria, you control how much illness actually comes in by washing your hands. That's still the #1 barrier. And I always add for you the places that flu, any type of flu, tends to come into us is right underneath our noses. So I always want to remind you, my Tuesday Transformers, the place where you want to be is at when you get home, in between the day, go ahead and wash your face. Make sure you're getting underneath that nose as well too, because that is truly, truly one of the best ways to control it. So just again, right now we have 100 confirmed cases in the United States. We have had 6 deaths in the United States. 4 of those 6 deaths were elderly and individuals who had already some other underlying complications. And those individuals really did all come about from that same long-term facility that we were mentioning in Washington. Some of our 2 newer cases have occurred in Georgia. Those individuals are in the same house. They are currently in isolation in their home. And the one thing that we did find with them is that they recently traveled to Italy. The reminder is, again, in the advisory, again, only if it's necessary. So truly, if you really don't have a reason to go to Italy, South Korea, Iran, or China, just don't travel there. The number one thing that you can do for yourself is to protect yourself by practicing those universal precautions, washing those hands. I know it sounds like it's a very, very simple, but trust me, I've been doing medicine now for over 9 years, and you will be surprised. This little habit that I have of every time I come into a room, out of a room, washing my hands, wiping down my stethoscope, cleaning off my material, taking this white coat off and really washing it every so many days, it makes the difference. And that's what controls the spread. We still are in just regular flu season as well. That goes all the way into March, all the way into April. People will still have some cases of that. So again, you are just as at risk, if not higher at risk, for the flu. And for some places, you can still get your flu vaccine for those individuals who feel it's necessary. But I do want to give you this tidbit. Yes, there has been 6 deaths, but John Hopkins has made this, has made mention of this, and actually I didn't even realize this until looking into this a little bit more and more recently and getting ready to talk to you all today, is that John Hopkins has let us know that since 2019, since the late February, December, November 2019, over 90,000 cases of individual infected with coronavirus. And 53% of those individuals have recovered. So really, there is more of a risk if you're traveling outside of the United States, if you're going to any of those individuals that have been highly infected, and then also too, if there's some underlying complications because of those 6 deaths that we did see in the United States. 4 of them were elderly, and they had underlying complications. So that is really it for our update for the coronavirus. We know that this is continuing to change because we're just getting new information over the course of how this is spread. Again, it is spreading, not just person to person. Last week when we were speaking about this was the idea that this virus is unable to live on objects that are inanimate, that are not alive, but now they're saying that maybe it is because they're seeing some of this spread. So it really is case by case, and the more that we look at this, the more that we talk about it, the more that we'll be more informed about it. So I want to encourage you to just get the correct information, speak to your physician as well too, so that you're just not off in a panic and in a frenzy looking for these masks and paying thousands of dollars for masks that they're selling online. All right, so that's all that I have for you all today. Thank you so much for joining. I want to say hi to Seni Tassi, Marina, Cole, Nicholas. Always good to see you. Nice seeing you, Mabu, Mali. Look at all of our Tuesday Transformers. Chin Chin, good seeing you, _1020. Hi, Dr. Krishan Sai. Good to see you. Add an _4, Purpose 4. Vic for real. Vertiz, Monica _Rose. Oh, so great to see you. Negro Shire, good to see you. I'm so glad you guys could join. Remember to stay safe. Remember to practice those universal precautions. Wash those hands. Do not neglect this little chart that still holds so much truth. And one of the most important things that you could do for yourself in protecting yourself and your family. And I want to encourage you too to go ahead And make sure you're washing your hands of the little children that are coming in and out of your home as well, too. Don't just send them, you wash their hands themselves. So this is the reality of what's going on with the COVID-19 and where we are as of today. You guys, great seeing you. Enjoy the rest of your Tuesday. Continue to transform your health. Continue to stay informed. I'll see you next time. Bye. Bye.